the best age is at least have one child before 30 years.
Don't you want your kids to study?
After 30, there is a steep decline. Once they have realized that they have all the challenges in their life sorted, a house, a car, a good husband. Now when they want to have a child, it's really becoming difficult.
I'm sure the school fees are skyrocketing.
Yes.
Everything is expensive to plan their future. Hello everyone. Welcome to the first very episode of The State of the Arts, hosted by Oasis Fertility in the good hands of science. These are going to be a series of podcasts where the primary focus is going to be on reproductive health, is this whole concept of family building and childbearing. Let's get started. So with me, our first very experienced, the gorgeous lady with a lovely brooch. I love the brooch, Dr. Fahida Madam brings across 4 decades of experience in the field of obstetrics and gynecology. Madam is the founder director, the clinical director of Femicare Hospitals, an excellent laparoscopic surgeon who has done several complex gynec surgeries. Madam, it's an honor to get a lot more insights into this fundamental and basic concept of family building. Welcome to our show today.
Thank you very much for your kind words, and it is a proud privilege to be associated with your scientific based fertility center.
If you could just, for all of us, just summarize these 4 decades of achievement that you have done into a small little word for us. How has it been as a woman achieving and chasing your dreams? And it's just not in India. I think internationally you've been recognized for the lovely work you do.
Single word, Chaitanya, it is passion.
So joining Dr. Fahida Banu is yet another senior gynecologist in just not Hyderabad, the whole country. And the first word that comes up whenever we think of you, madam, is robotic surgery.
Thank you.
Robotics in gynecology. We never ever imagined have this amount of diversification and advancement. So Dr. Ruma Sinha, the lead senior consultant gynecologist, Apollo Health City, visiting professor at the University of Sydney, Australia, and to All Indian Institute of Medical Sciences in Rishikesh, if I'm not wrong. But in this whole world where traditionally in India, I think we've always seen man goes out and he's the one who earns, but woman is more of a lady who's taking care of the home. But contrary to this, I think you've had a very, very successful career, and I think you've equally given a wonderful support to the family. How has it been all these decades for you?
Yeah, thank you, Chaitanya. Thank you for, first of all, involving me in your first podcast. Having said that, women have to do double the job. No mistake, don't mistake my word. We have to do double the job, not just home and office, but we have to also do double the job in the office to prove your worth. It's true. So many decades of saying gender equality or whatever, we are still back to the same. So I work with one philosophy, and that's a very old Japanese philosophy called Ganbei Masu. You might have heard. Just means put your head down and do. If you have a passion and you think this is what I want to do, don't listen to right left, because there will be many right left, and people will just make sure that you don't achieve what you want to do it. And that has been my philosophy. And you said nobody thought what we can do in robotics in gynecology. Well, I started in 2011 and 12, almost 12, 13 bags, and I was really ridiculed and made fun that everybody said, what is the need for it, right? But today everybody is at my doorstep saying, how do I learn? I said, great.
Joining us next in this panel is yet another visionary lady. Needs no introduction. A very popular figure on the social media. May I have the honor to introduce Dr. K. Shilpi Reddy, Clinical Director, Kim's Cuddles Mother and Child Unit. Madam, Shilpi Reddy brings across 2 decades of experience. She is known to deal high-risk obstetric cases, an excellent laparoscopic surgeon, and an infertility specialist. Welcome to this show, madam.
Thank you, Krishna. Thank you for the introduction. And it's lovely communicating with the current generation because they definitely need a different approach. You can't go with the conventional way, being a doctor kind of a thing with them.
But we'll come back to the family building concept again. And, Madam, I get, and I've been interacting with you. You are blessed with 3 kids.
Yes.
In the present generation, with all these lovely achievements that you've actually accomplished in your career, how do you get to balance between your family and your professional life so very well?
I love kids because they are the energy that you are at every moment. And I never see that, having kids is going to put you back anyway, because our elders had 10 kids, 15 kids also. They had a very balanced life and they took care of huge families. We are taking care of hospitals and other professions, but they also took care of, agriculture or whatever by means that they could do, they did. When you go back home, a lovely soul sitting there waiting for you and to interact with them and to talk to them, and it's a blessing. And I would definitely, if given a chance, I would have had more kids. But yes, I had my own conservations.
I think that's a lovely way to put across, madam. We really, in the present day, as we all have been discussing here, it's nice to see that women are empowered. We have kind of broken the stereotype belief of putting women more into the house, behind the scenes, and she should be more taking care of a lot of things. And I think nature never told us that. We assumed that's how it should be. So, madam, how do you think this whole Indian society in the last 3-4 decades has undergone what kind of reforms in terms of their approach towards building a family?
See, always family is a strength for anybody. But the entire concept of family has drastically changed in the last few decades. We have forgotten many things, as she rightly told, in the rat race, but always we have to come back to balance. Yes, joint families, the social security, supporting each other was our tradition.
Lovely. So I think, we will get Dr. Shilpi, probably the best person to take this question. Madam, what is your, so aptly and such a pertinent point, in the present day where I'm sure the school fees are skyrocketing and everything is expensive, to have a domestic help, to plan their future, everything is involving a lot of money. I'm sure there's always this wish to have more kids, because we know it's an amazing thing when we come back to see, to play, to make memories.
When you talk about such concepts, do you even have any look at mental wellness? There is no mental wellness in temporary relationships. And at the end of the day, you've crossed 40, 50 years, there's nobody to take care of you, there's nobody to even talk to you at home. You come to an empty home. There are 2 different things that we're talking about. One is where you go through the norms of the society, where you have the right time to marriage, you get married, you have children, you enjoy the time with your children, you be responsible, you take care of them, you grow them, and you create them as responsible individuals. Wherever they want to go, that's where they go. And that is you, and you have been brought up like that. That is the truth, and that is how the entire world runs on. And if you want to be different, isolated cases of difference is still okay to be running in this huge world. But if everybody thinks so, what would be left over with is chaos.
So now that we've got 2 insights, as Dr. Ruma, I'll come back to you. And I'm totally with you. It's nice, and I believe that every woman needs independence in every aspect. But is there a way she needs to draw a line?
I think we are taking the whole thing in a different manner. It's not correct. I think there's just no point in comparing what I was 30 years back or what she was 20 years back. What you are thinking makes no sense. What makes sense today is to see these children, both men and women, in the light of what they are struggling with. It's not that their life is very easy.
Not at all.
Not at all. Not at all. And what are their problems? It's not just earning something or doing something. They have a fear of losing job tomorrow. There is not financial security. In fact, I would not put all the blame on them. I'll put some blame on us.
True, very
Right? Most parents don't want to go and live with their children. They don't want to look after their grandchildren. They will just maybe would want to take that responsibility, which other earlier grandparents will. So it's a give and take between generations. So I think it is wrong to be thinking that only this generation is going astray. But I still feel that we need to calm them down and say, fine, if you're married or you want to start children, we are there. We have your back. How many grandparents today stand and do that? Very few. I'm telling you, very few.
Yeah.
I look around my colleagues and everybody is having their own life. Children we had more support.
Absolutely not.
Where is that support for them? Can we give them that? So I think I will, instead of putting that generation back, I'll put our generation on the katkara today and say, okay, we need to reinvent and think about ourselves.
So that was so brilliantly put across from my very experienced gynecologist about their views about the basic ethos about the society, how things have been changing. And Dr. Ruma, I just love it. It's about adapting and changing.
It is still change. Change is essential.
Need of the hour. So I think the summary of that little discussion with my experts was, I think the need of the hour is to change, is to reform, and is to evolve. And that is where I think this whole concept of bonding, family building will probably bring in more joy. I think expectations have to be kept realistic. I think that is when we are really going to cherish every moment, make up more memories, and that is what a lovely family is all about. So I think, now we spoke a bit about the family building and all. So now let's get more into the signs of reproductive health. Given the current circumstances of, changing lifestyle and the risk factors that we all are exposed to, what do you think is the average for a reproductive age? What do you think the age to conceive for a woman, Dr. Ruma, if you would want to start off with that?
Well, you have to base this decision or suggestion on some scientific facts. I mean, we are no way to say that, we know all and this is what it should be. But looking at more and more young girls coming in and younger women coming in for fertility treatment with low AMH with no ample reason, right? Why this is so, I have some take, but I don't know whether it's scientifically proven. So I think maybe between 25 to 35. We usually used to say till up to 35, but then I think.
So, Dr. Shilpi, in your obstetric practice, what do you think is a mean or a median age of most women coming with natural pregnancies and for antenatal checkup with you?
We are now in a very dynamic trend of late 20s and early 30s coming in with the larger numbers. But again, you're talking about pregnant women. And I have to tell you that fertility is a gift right now. And I would definitely want somebody who's really looking at the normal trend to get pregnant before 30, because after 30 there is a steep decline in not only egg reserves, it is also about egg quality, and it is also an unknown factor that we talk about, implantation rates. They're drastically dropping to an extent that we have a lot of people with unexplained infertility, and once they have realized that they have all the challenges in their life sorted, a house, a car, a good husband, a family, now when they want to have a child, it's really becoming difficult. And all the money in this world is not able to give them that gift of a child. That is when they go very low and they are depressed and already kicking in so many other aspects of, profession, family, cultures and people talking and all that. They are really hitting into mental unwellness. And it's not oversaid, but given an opportunity. With my personal experience also, I would say that below 30 is the best time to consider getting pregnant.
So 20 to 35 from Dr. Ruma, 30 Dr. Famida. I'll come back to you because I'm sure when you started off, 80s and 90s, you saw that trend of teenage pregnancies, and I think, lovely campaigns where we actually got over that whole complications and that segment of teenage pregnancies. So now what do you think? 20, 30, 35, where do you want to motivate women in reproductive age to start building families?
The best age is at least have one child before 30 years. As early as 20, I wish. So it is not everybody should have to follow this, but this is my advice. You have parallelly your academic career, your financial independence, your dreams which you want to chase. Please go ahead and do. Just because having a marriage is not going to stop it. You want to develop the congenial atmosphere. The one more thing which makes me very worried is Dr. Chaitanya. Nowadays we are seeing many problems scientifically, medically, more cases of endometriosis, which once upon a time a disease of 40 plus. Now I am sure Ruma also is being a robotic surgeon. We are dealing with teenage girls with the endometriosis. We deal so many laparoscopic patients, teenage with endometriosis, grade 4 disease. And one more disease which I feel very depressing is malignancies. Malignancies of the ovaries. Recently I have referred to Oasis. A patient, she's a doctor, just doing internship, had breast malignancy.
21 years old.
He is just 21 years completed, and we have referred to Oasis to have egg preservation. It is so depressing. At 22 years, you are having breast malignancy. Whatever may be the etiological factor, this is a fact. There is a definitely precedence of malignancy incidents, and endometriosis have become a very rampant. Why to face all these medical issues and gynec complications? Why not you think, plan? This generation is very intelligent, very well informed, very well read, and they are more smarter. So my advice is plan the things parallelly.
Yes. So Dr. Ruma, Madam brought out a very nice thing about fertility preservation. I'm sure being at Apollo, you deal with a different kind of educated population most of the times. So how welcoming is the younger generation with this concept of social egg freezing?
Very, very welcome.
Very welcoming.
Very welcoming. And for a minute, let's just go across about what is the right age or not right age. There is definitely a decline in fertility. Correct. There's no thinking about it. Why it is? Could be various factors. It could be right from environmental to dietary to lifestyle. And I also feel another thing is basically losing the egg reserve. Girls are even having menarche so early.
Yeah.
Right? So there's 7 years advance in menarche, what 20 years has happened. So they have been actually recruiting their eggs 7 years earlier. Naturally, they'll fail earlier. Simple. I mean, this is something logic we are not thinking about it, but I'm thinking. So if that's happening, apart from the social, the study, it's not very easy to marry everybody at right age. So many factors are involved, right? So I think it's a good idea to check, see your fertility status. Because a lot of women, girls today come and ask that, can you do this check for? How much time I have? I said, I cannot say time, but yes, we can do something to let you know what your fertility. So if the age much is down, maybe we can do a serial over 6 months or something. If it's down, then I think you guys are the savior. Preserve the eggs.
Ruma, don't
see, as we are changing the technology, taking so much, this is another technology available in us. Might as well.
So Dr. Shilpi, I'll just, get you to take a little controversial question here. We've seen a lot of celebrities in the social media coming and speaking so open about, what I chose to freeze eggs and I've preserved my fertility so that my career doesn't come to a standstill. What is your take on this? Is this the right thing? Is it really taken in a positive way by the younger generation, or you've got some parallel thoughts on this?
They have at least a takeover going towards pregnancy in the future. whenever your profession needs a certain kind of conduct and you can't go against it, at least thinking on the terms of having a family, a child, and using technology to get that dream successful is nothing wrong. And being prepared for it is very welcoming. At least she would not be in a situation of taking donor eggs. Nowadays, it's a huge stigma whether to go for donor egg or a donor sperm or a donor embryo. The consequences of having that and living that with that children is not very welcoming in the current scenario, and mental differences can creep up at any given point in time. Then they would fight over their faults. I've seen so many people who at the moment want to get pregnant and they go in and get pregnant with donor gametes, and after 2 years when they deliver and they have responsibilities and the time of sacrificing their career for the family, or in a tiff, blame each other.
Lovely. So I think it's all about balancing. We spoke about this throughout this segment today. So I think building a family and postponing this whole episode of childbearing, I think the current norm is to delay it a little bit. We do not want an early pregnancy and family, which sometimes is actually killing our dreams. That's probably not the best thing to do. But on the other side, we've got the fertility, which is declining for a lot of environmental and lifestyle factors. So I think it's important that we become more aware about the situation. Every body is different. How our body responds to the environment and the changing lifestyle is a different story. So I think it's best we all, when we want to postpone this whole episode of childbearing, it's best we see a gynecologist, get their insights, and if it is advisable to wait, then I think you're all good to go and achieve your dreams.
I think my friends will agree. Nowadays, we are seeing more number of women with premature ovarian failure or premature ovarian insufficiency.
Yes.
It is really very scary.
It's alarming also,
Alarming.
the rate at which that we're
So,
seeing patients.
I think we should make the younger generation aware, so that
Like how you check for, like how you check for thyroid annually,
Exactly.
at least how you check for your sugars.
So
You have
check for
financial
fertility
security, check for
potential.
AMH.
Yeah,
Check for your AMH
exactly.
at least once in a
So
year.
I think that's more of the solutions we're going to talk about. Sorry,
Instead of
interrupted you
thinking that
there.
having irregular period is a norm, nowadays many girls having. Instead of that, you consult your gynecologist or your physician. They will guide you properly.
And the PCOD incidence has gone so high that instead of having routine clinics, we should have some PCOD clinics, identifying them and helping them out with their problems.
Having
With the
PCOD is a lesser devil than having the premature ovarian insufficiency.
Insufficiency.
At least this is treatable condition.
Now that you all have
Very-
brought this across, you say now for cervical cancer vaccination, what we're giving, we say 9 to 13 is probably a better age, and I'm sure that awareness is actually going up. Similarly, for a pap smear or self-breast examination, I think the awareness has gone. Similarly,
Yes,
do
awareness
all
on
you think
AMH.
that awareness that AMH is coming down, the ovarian reserves coming down? Is there a age or a particular point where we probably educate the women in reproductive age, probably the adolescent girls, make them more aware and probably have one routine
It is a
gynecologist?
little toward.
Yes, mid-20s will be a good
Mid-20s?
I
idea.
would say about 25, 26.
Yeah,
correct.
mid-20s.
I think around 25, a girl has a right to also look her fertility potential today.
Yes.
Knowing the fact that in the background we don't know, nobody has this written here, that I'm losing my egg reserve is going down because, you cannot see a somebody's face, I tell you that.
But you will have that mental
But
maturity.
Might be a good idea to now, because we have done making our girls and women smarter by talking about contraception, that you must know about it and use it, that's your power, and then talked about so many other things. I think talking to them a little bit about their fertility is the need of the hour.
Yeah.
Because we as gynecologists do see young women coming in and they get married and within a year they're not conceiving first thing, and you do an AMH and it's low. So I'm at loss and she's at loss. I don't know what to do. So maybe if she knew 3 years back, even before she got married, she would have frozen her eggs. That's good.
So everything in what was in the past our traditions, cultures, our beliefs are slowly coming back at times, be it our food practices, a lot of things in our life. So, Dr. Femi, you really think, our grandparents and all in the past, wedding is over and then every month they would come and say, Pedi kab khila rahe ho, khush kab suna rahe ho. They used to literally be after, and sometimes this is creating a lot of pressure to the women. I'm sure that's other thing that needs to be also looked in. But I think, going back to those things like, okay, once you are sure of starting a family, you shouldn't be delaying it. Go to a doctor, get a basic screening done and get started with this whole pregnancy episode and close it once for all.
I think that is not a bad idea, but nowadays looking at such a volume of infertility and various reasons, and we just discussed about low MH, premature ovarian insufficiency, early malignancies, maybe the history will repeat itself. This generation right now the generation of Z has gone. We are getting alpha generation. Very soon we will get beta generation. What is their thought process? We don't know. And children or next generation have their choice. It is their choice. It is their life. They have to make their decision. We can only advise them. We can only guide them. But I personally feel the history will repeat itself. Like how you are rightly told, we are becoming again traditional in the food habits, in the exercise, in the yoga, and the feeling of well-being. Maybe the generation will rectify their decisions and come back to the value of the fertility and its significance.
So now let's throw some light on the current scenario, the way this whole infertility segment is shaping up in the Indian context. And I was a little taken back the other day when I was looking at the National ART website. In India alone, there are 6,000 applications for fertility clinics. And the state of Telangana has 300 applications which are already approved, which means there are going to be 300 fertility clinics all across different districts of Telangana. So I think awareness about fertility and access to healthcare both seem to be equally going hand in hand, along with the decreasing fertility and increasing incidence of infertility. So that's one segment. But what concerns me in terms of a trend is, well, people are so aware about all of these things, they want to postpone childbirth, and at 37, 38, suddenly they realize that it's high time to actually build a family. And then they walk into the fertility clinics and then we say, oh, reserve is less, or because you're 38, I would probably want to do IVF, and I would want to probably do a pre-implantation genetic testing, put back a euploid embryo because that kind of brings down the risk of a Down's baby or gives you a genetically normal child at the age of 38. It was nice to wait and look at career, but in terms of what you're doing in terms of intervention to have a child, don't you think this is way too much extreme? Dr. Ruma, what was your thoughts on stretching it this far?
I agree, stretching it that far is not good. I don't think any gynecologist will agree to that. But you have to also look at overall society, what are the things going on, what was the problem with that particular couple. As I said, let's not be at any point judgmental. There could have been some reasons why they could not go for it. Possible, got married late, for all you know. People marry late these days. So I firmly believe at this point of time, yes, the need of the hour is that we have to make our women smart. Check your fertility. If it is not good, freeze your eggs, at least have an option for future.
Lovely. I think that was...
This is really, I would feel that it's important. Having said that, it's good to be at the right time, right place, right age, have a spontaneous conception, have children of your own, which is definitely lovely, but may not be possible for everybody.
A lady who's probably in her late 20s, do you really think that it's more because people are not giving enough time for personal intimacy is one of a prime reason why people are infertile in the present generation?
I agree.
You agree with that?
Absolutely.
Do you really come across such couples?
Yes.
Where
yes.
their thoughts are like, oh, you know what?
You may be saying Shilpi has that campaign running, but this is a common question I ask my office.
Okay.
I mean, is it only a weekend or is it how many times a week?
So what should be the right practice?
It's difficult to say because, as you said, this all comes out of intimacy. It could be there, it could not be there. But when they are trying to conceive, I give them a block 10 days time. I don't say 13 days, 14 days. You cannot be. Biology is not mathematics. You're going to have mathematics there, right? So day 10 to day 20, they will hit the right time. And then give them a little bit of idea that, you know, and I'm very simple. I tell them a few things, and I think because I think we may be sharing with regular population, that the egg is released only one day in your cycle, one particular day, and it's more or less alive in the system for about 24, 26 hours. Am I right?
Yes.
For it to fertilize, the sperms have already to be there.
Yes.
You can't have the sperms coming in after the egg has got
It's
released.
supposed to survive for 48 hours.
Yes, 48 to 72 hours. So they have to be there in the system, and especially the fallopian tubes, for it to fertilize. Natural. I can. Yes, they can. But then you have to hit the right stage. So you'll have people or couple living up separately, part of the job or whatever it is, or maybe only weekend they have the time. They might have missed that one day and they think they're infertile.
I know, sperm doesn't know what Saturday night is.
Yet. Exactly.
So, ma'am, what do you really think? Is this a great idea? Because I see a lot of people so being dependent on apps in their phones. You ask them when
New fad right now.
Please.
That's a new fad right now.
There are many apps you have to tell them first delete it.
Yes.
Yeah. And
Because we are actually dealing with human biology and not a computer, and our hormones never work like that, and our cycles never work like that, and we should stop comparing ourselves to any instruments. And there are thousands of variations in men and in women, and it cannot be compiled into an app by whatsoever means. And as you said, there is a lot of demand supply. There is a lot of demand for fertility treatments and fertility clinics. That's why the government is under pressure to sanction so many clinics. And I still see 90% of women coming with pregnancy, not even a single folic acid tablet taken in their entire life. This is the state of education that we have given to our women. This is a state of empowerment that we have given to our women. They are very, very versed with what is in the fashion, what is in the trend, what is in the computers, what is in the app. Yet, thousands of videos by eminent gynecologists, eminent doctors to at least start folic acid before you plan pregnancy is unheard of them. And they never follow that.
Emotional support are very essential when somebody is planning to conceive or is going through this little stressful phase of infertility. So in that
No,
context,
you answer my question. Why male infertility has steeply increased?
well, I think, ma'am, like the female, men are no different. And in fact, I would say men are probably a little worse when it comes to their bodies, because the amount of, chronic smoking, binge alcohol, obesity going up steeply. I think that whole syndromes of metabolism becoming imbalanced, and the environment that's actually gone wrong, and the sleep patterns have
yes,
Exactly.
I think 6 to 8 hours of a sound sleep.
No, not just the hours.
Yeah.
Timing.
The timing is important.
Timing is important.
Because
Going right.
there was a very interesting podcast by BBC about all this. And they were looking for, actually not infertility, but what you also mentioned about earlier decade of having cancer. So there are many things to it. The biological clock we are talking about different, but our biology clock is there in 24 hours.
Yes.
So if
Follow the sun, actually.
Every day, if you don't sleep at the right time and get up at the right time, you can't fight your obesity. Do you know this? If people say, I'm doing everything, but I can't lose weight. I say, what time are you sleeping and what time are you getting up? Just change that and do whatever you're doing to lose weight. It's very simple. You need to expose yourself to sunlight as well as to moonlight.
Great.
We don't get that. So these are
just back to the points. If you could just, as closing remarks, tell us few tips for people to conceive naturally. What would you tell your patient, where medically you don't really see anything alarming there? What are the tips that you would want to give to your?
So my advice to a couple who comes and say, say we are planning a pregnancy, what to do. I'll just look at their age and the years of marriage, because both are important. Age is important because I need to know about the quality of eggs and the sperm. And the years of marriage is important to tackle their panic attacks. So if they are 6 years in marriage and they want 1 month in pregnancy, nothing will happen. So first thing to tell them, for an unexposed sexual activity, 1 year it takes to get pregnant, so have patience. But I will also do, because of their age, at least do basic female fertility test and male fertility test and see, okay, you're fine, go. Once given that, I said 6 months I don't want to see you, want to go for vacation, please go for vacation, but you follow these things. Daily exercise, eat healthy, expose yourself to sunlight and moonlight, eat all color vegetables and all color fruits, because that has all the micronutrients and the things that will help you. And the 10-day rule. Day 10 to day 20 is my target. And I said, okay, day 10 to day 20, if you are together every second day or third day, there will be some sperm swinging in that fallopian tube when the egg is released.
Lovely.
That's all you need to do. And in this 1 year, if you've not had those 10 days, 6 months, then you've only tried for 6 months. So don't get panicked.
Yes.
And most of them come back.
Lovely. So, Dr. Shilpi, are there any few symptoms or few things that you would recommend and tell your patient not to ignore when they're planning to conceive or in the reproductive age? These are certain things you really notice. Please see your gynecologist at the earliest. What would they be?
It's very important to have your bodies checked on a regular basis. Irregular periods and weight gain is an absolutely dangerous things that are happening with you. That means there is something wrong in the body that is not reproductive friendly. And another very, very important thing is, if men are working too much or into substance abuse, or they're not adequate in their sleep, their analysis and quality parameters have to be really checked, because they might look all good and mature, but the sperm quality is bad these days, because there is so much abuse in terms of taking testosterone supplements and bodybuilding and all that is happening. And women, again, they have to take care of their weight, age, physical health and mental health altogether. And even till date, what I simply say is, you should not stress yourself. That's very, very important, because stress is something that actually works against everything that the biology wants to work on. And spend some quality time with each other, because time together will matter a lot. And whatever said and done, women are at the receiving end, that if pregnancies are not happening, world sees women at a different level and men at a different level. So it's your duty to take care of your health, wellness, and support yourself in such a way that you are not only strong internally, you should be strong physically, mentally, emotionally, and that's the actual state of and definition of health.
That's a great piece of advice. So, Madam Femida Banu, I'll just come back to you to close this lovely discussion that we have had all about building a family and childbearing. They keep saying the biological clock is ticking in the present day. Is it ticking, or the alarm's long back gone? What are your closing thoughts on this?
My type of patients are very, very variable. I get patients from very traditional family to dink couple. So I feel that treatment should be individualized. There is no one treatment which is applicable to all the couple. We have to understand their problems, their requirements, and give appropriate advice and treatment.
Well, those were our lovely thoughts from that amazing insights from our 3 experienced guest faculty today about family building and childbearing. Careers are important, but your biological clock is ticking. So when you decide to postpone, all that you got to do is see your gynecologist and get a little piece of advice, and you're all good to go and achieve all the dreams that you've dreamt of. Keep watching more updates from our end, the State of Art series from Oasis Fertility in the good hands of science.